On this day, I had 3 patients at the beginning of my shift, and I was expecting to have one more patient. Turns out, sometime around 10 p.m., I had a patient who was kind of reacted upon because this patient had an increasing heart rate. Turns out when the React team or the rapid response team came to the patient's room at the med-surg unit, the patient was currently in SVT. Heart rates were in the 150. And so because this patient was above the care on the medical surgical floor, they had to be brought to the step-down unit. Now, this patient had to come along with the rapid response team who were monitoring the patient as they transitioned from the med-surg floor to the step-down ICU unit. It turns out that this patient was also on isolation, and so isolation precautions had to be enforced. Now, the orders were already in for this patient to receive adenosine. And so when the patient had hit the room, they had to look to see if the medication had already been verified by the pharmacies and, just giving them an okay to go ahead and pull the medication from the pixies, as well as that which the pharmacies had to bring up to our unit. It was then time to push. But guess what? This patient had paroxysmal SVT, meaning that the patient kept going in and out of SVT. For the sake of the new nurses on my channel and who will be wondering what kind of symptoms was this patient showing off, this patient was having palpitation because they kept saying that they could feel their heart pounding in their chest. They were also very anxious. They were not really agitated. My charge nurse came in and held the patient's hand because at this point we were trying to calm the patient down. Now, the patient wasn't new to SVT. The patient had verbalized that this was actually the 3rd time they were having this SVT. And so they kind of knew what to expect in terms of reversing or converting her heart rate. Now, she said that for the previous 2 times that they had had it, she felt like her heart stopped. And so the reason why she was very anxious was because she felt like, hey, when she's going to be giving this adenosine, she was scared as in, okay, if my heart should stop, does that mean that I could potentially die? So the charge nurse was in there, trying to give her information, trying to let her know that it is not something that can necessarily lead to death, that is what is expected of adenosine. And so, with that conversation, that calmed her down, even though she was so nervous looking at her heart rate. Blood pressures were okay, her respirations were okay, her O2 sats were okay, she was on room air. The only thing that we were monitoring at this point was just her heart rate. Heart rates were in the 157s, 158, 160s. And, once in a while, she converted to sinus rhythm. But the most that would last was just 2 minutes. At some point, she converted to sinus rhythm and it lasted only for a minute. Once the adenosine was prepped and ready to push, we watched her heart convert beautifully from SVT to normal sinus rhythm. And she stayed all through my night shift on sinus rhythm. In my 4 years of being a nurse, this was actually my first time of seeing a patient in SVT and being treated for SVT. Bye and stay tuned.